In my years of nursing, I've held the hands of many. One lady in particular stands out to me. After being told she was in remission for over a year, she returned to the doctor to be told that she was terminally ill with lung cancer. At this point, she chose to forego chemo and radiation as she knew her body wasn't strong enough to handle the treatment. I had several conversations with this lady, but two stuck out to me. The first being the day she asked me for the chaplain to come visit her, so in prayer she could make it right with her faith so that she was ready to pass. The second was the day she asked me for morphine and to leave it at her bedside so that she could speed up the dying process. Dying doesn't happen on our own terms, but this lady was ready. This is why I ask you to consider medical aid in dying. This is a process by which the patient commits suicide using medication provided by a physician prescription. This prescription is provided only for the instance that the patient is committing suicide. However, this is not legal in all states at this time. In Miller's 2006 publication, he outlines the criteria that must be met in order for a patient to receive such a prescription. The first is that the patient must be a resident of the state in which legalizes medical aid in dying. The second criteria is that the patient must be considered to be terminally ill. This is meaning that they have less than 6 months to live. The third criteria is that the patient must make 3 separate requests for the prescription. Now, within that criteria, there are sub-criteria. The 3 separate requests must be submitted at least 2 weeks apart, and one of the 3 submissions must be written. A second physician must also confirm the diagnosis that the patient has less than 6 months to live. Now, the physician may consider and request psychiatric review of the patient in order to deem mentally competent to make such decisions, and also to investigate that there are no other financial motives behind the request. The physician must offer alternatives to the patient other than medical aid in dying. This can be hospice care, palliative care, or other such options to create comfort in the end-of-life days. The last criteria is that the patient must self-administer the medication. This medication, though prescribed by a physician, and the prescription is to be given as prescribed, cannot be given by a third-party person. This is then considered homicide. If the prescription is self-administered in the state that allows medical aid in dying, it is still considered to be a legal act. Now, there are a few considerations to take underway. The first are the ethical considerations. The Hippocratic Oath is one of the main fights against medical aid in dying. The Hippocratic Oath states that the physician will not administer poison to any patient. Now, when thinking about medical aid in dying, some people consider this medication that is being prescribed to be a poison, as it is ending the life of a person. They consider it not to be a beneficial aspect. The other part of the Hippocratic Oath to consider is that physicians will only do benefit to the patient. Like I previously said, some people consider the ending of this pain and suffering to not be beneficial, as it is an act of suicide in the end. Now, one of the other ethical considerations is without this prescription, the patient or the terminally ill person can be experiencing insufferable pain. So I ask you, is medical aid in dying beneficial, or is it harmful to the patient? By letting them sit in pain and not providing this medication, are we harming them, or are we benefiting them by allowing them to continue to live? The ethical theory that kind of backs up medical aid in dying is the Kantian theory. This theory states that all animals, human and non-human, should be treated with the same dignity, autonomy, and respect. Now, when I say that, you think of a dying pet in your family. This pet's no longer able to get up, go to the bathroom in a respectable place, which is in most houses considered to be outside. This pet is not able to eat anymore, not able to drink, and is not able to run around and play as it used to. And at that point, what do you consider the quality of life of that that pet to be? Now think of it as a person. In dying, this patient loses all dignity and respect. They begin to soil on themselves. They no longer have an appetite to eat. They can be in insufferable pain. However, the difference between the pet and this patient is the patient can voice all of these concerns to you. But what do you do when your pet is like that? You take them to the vet and they get put down in a respectable and dignified manner. But what do we do for our loved family members who are voicing that they are in pain? That voice that they just don't want to live anymore. We make them suffer. We make them wait day in and day out until death comes. Now, to me, we are treating pets with more dignity and respect than we treat our loved ones. Granted, some pets are family members in some households. But for humans, we make them wait and wait and wait until one day their suffering ends. Don't you think we should be allowed to make those decisions for ourselves? All of our lives considered to be an adult, and now the choice isn't ours. So I leave you with that. Is it ethical to help somebody end their suffering, or is it ethical to allow them to sit and wait for circumstances out of their control? Thank you.